Olá! A nossa convidada de hoje para o Escoliose Talks 2020 é a fisioterapeuta holandesa Janine Kerstholt. Ela se dedica há muitos anos ao tratamento da escoliose e a sua história é bem interessante. Quando ela descobriu que muitos pacientes com escoliose na Holanda eram operados, que não era oferecido um tratamento conservador à altura, ela se dirigiu a Asklepios Katharina Schroth Clinic, na Alemanha, para se especializar na terapia pelo método Schroth, para tratar escoliose. Na Holanda, na época, não havia esse tratamento, como eu disse antes, para um tratamento conservador especializado. Em 2012, ela decidiu iniciar uma clínica especializada em tratamento de escoliose na sua cidade, em Utrecht. Começou a cooperar com médicos e técnicos alemães em Bad-Sobernheim. Para que vocês saibam, a cidade de Bad-Sobernheim é o berço do método Schroth, na Alemanha. Então, ela se uniu com esses métodos e teve uma cooperação muito íntima para formar uma equipe de alta qualidade no tratamento conservador da escoliose para seus pacientes. E como ela ficou surpresa com os resultados, iniciou em 2019 uma pesquisa sobre a efetividade do método Schroth no tratamento de seus pacientes com escoliose. Em 2019, recebeu o certificado de instrutora para a parte 1 e 2 e atualmente ela ministra cursos do método Schroth na Holanda. Vocês vão ver que ela tem muito a nos oferecer também, explicando sobre o seu trabalho e o que ela faz. Assistam! Dear Janine, I'm very happy to have you here with us in our Escoliose Talks Brasil, because in addition to having a lot of admiration for you as a professional, I have a lot of affection for you as a dear friend.
Thank you very much, Patricia. I'm glad to help you and to come in your video and to tell my story and my experience. And I'm very pleased that I can do that. I'm very honored that you invited me.
Oh, yeah, dear. I remember that we first met in 2011 when we were part of the first sales approach class for foreigners. And since then, we have met regularly at SOSOT meetings, no?
Yes, yes.
I also have good memories from 2014. When in Germany, when we met Asklepios Clinic in Bad-Sobernheim.
Yes, that was
good moments, no?
That was with the brace factory in Sanomet in Bad-Sobernheim.
Yes, yes. It was fantastic, no? Thank you for that.
I'm still working with that clinic and that brace factory, and they are coming here very regularly. Tomorrow, actually, they are coming again. Wow. And we have all my experiences with their braces. They make it. They are very good braces, and that's part of my result.
Oh, good. Yes. Yes. A good brace is important, no, Janine?
That's part of it. The other half is of course the physical therapy treatment. We need 5. We need a patient who wants to cooperate with us, and parents. Yes, you need. So all together, a good doctor. All together, we can bring the treatment to a good end.
Yes, fantastic, fantastic. And I would like to start our Escoliose Talk today by asking you, how many years have you been a physical therapist, and how long have you been dedicated to scoliosis?
I started as a physical therapist in 1978, and very soon I started with my education on scoliosis treatment, conservative. That was in that time in my country. And I worked with scoliosis patients at the time. Afterwards, after 10 years, I stopped with physical therapies, and I was a computer scientist in a medical case. I did it for several years, and from the 2010, about 5 or 10, I came back in the physical therapy. And then I found out that my colleagues, they couldn't treat the scoliosis patients anymore. They only said, no, scoliosis needed surgery, no more, we can't treat it. And I was shocked about that. That was the reason that I went to Germany to the Schroth clinic from Asklepios Katharina Schroth clinic to start my education. And later I went to EasyCo Milan to the CEAS therapy where I met you. So, and later I did the CEAS second advanced course, and a few years later I went to Barcelona to Manuel Rico, and I was more and more educating myself, and in the meantime I started a specialized clinic for scoliosis patients, which I have now. Mm-hmm. And in the meantime, I went a teacher of Schroth therapy, what I am now. So that's very short, my big part of my life. Yes. And this year, for the first time, I had results of my treatment of all those time.
Yes, of course. And that is the further question. Because this year, you would be presenting a paper at the SOSOT meet, that you have been taking place in April in Australia, if COVID-19 doesn't.
Yes, I was very disappointed that I couldn't leave for Australia, because it was the first time I wrote an abstract. I can show you here this abstract. I wrote this. So yes, good. But yes, it was very sorry, but I couldn't bring out my results. Now they asked me for the web-based SOSOT meeting in 20 June, but I did a withdrawal of my abstract because now I decided to bring it again next year in San Sebastian, and then I have more data. And maybe I can convince people more, but I can bring you the results in between, not exactly, but more or less. It's really convincing.
Yeah. So it's can you tell us something about preliminary results? Only that you can. It's possible for you to tell us.
Of course, because the results next year, they will be a little bit different, of course, different numbers of patients. It is now from all of the patients, what I found of all the last 10 years, I started to bring data from children who came to me with a cup angle, a curve with a cup angle less than 55 degrees. So I took that group. And then the children who were not full grown up. So in our professional talk, it is between the RISA 1 and 4. So that is one of the group. The other thing is that they shouldn't have prior treatment. They shouldn't wear prior braces or have prior other treatment. And the other thing is no other diseases like Marfan or the obesitas or the things like that. So that reduces the amount of subjects you have. So at the end, one moment, and they should have the Schroth treatment in combination with, braces. So that was actually my group. And that ended on a group of 28 patients. But we can see a lot of those patients. After treatment, I saw that 2/3 of the kids had changed their curve. They reduced the curve between the 6 degree and the 20 degree at the end. And what we did, measurements of the cup angle, and that's actually radiologic. And then 48 hours they had out of brace, at least. So some were completely finished, others had 48 hours out of brace. So we can see what happens then. From that group, 2/3 had a reduction of the cup angle between the 6 and the 20 degrees. So that's a lot. And from the other 1/3, they stabilized. So from the whole group of patients, no one had to increase the cup angle. No one needed surgery. And the other thing I found out was when we take a look of the children who came, what we call late onset. So children, they had already far in their growth. In our professional talk, it is RISA 3-4. From those group, those kids, they get never treatment here. Then always the doctor said, you are so almost grown up. It doesn't make any sense anymore. So we'll see, look and see what happens. Maybe your curve is increasing 5 degrees, no more. From that group, I had 11 children. And from those 11 children, 90% decreased the cup angle at the end of treatment, or at least 48 hours out of brace. And 10% stabilized. No one worsened. Wow. So that were very good results. But it is a small amount of children. So that's the reason I withdraw my abstract, and I hope next year that I have some more data to convince everybody a little bit more.
Yes,
so maybe it's up to 30. But the results are good, and it shows that also with the children who have started the treatment very late, with 15, 16 years, for example, and took a brace, then mostly they say, we don't do a brace anymore, but they took a brace and they took the treatment and they did very good, their best. They decreased the curve very much. So that's worth to do. When you can decrease the curve of a girl, the mean decrease was about, I think I have to take a look, one moment. It was about 10 degrees was the mean. So when you have a curve of 40 degrees and you can reduce to 30 degrees, then it's much better for future for the girls, because we know that with a 40-degree curve, when they finish the growth spurts, they are adults with that, we know that when in future years they will increase again, and when they are over 50, they are coming in the second period of worsening of the curve. So when you can decrease that curve from that older kids to 30 degrees or less, then it's much better for the future for those children. And when we can decrease, I have indeed girls who started with 16 years and had a curve with 40 degrees, and she finished now with 24. So it's not necessary for her anymore to be worried about her future. But while her own doctor said, you shouldn't wear the brace anymore, a little bit Schroth therapy maybe, but you only can worsen 5 degrees. But then the end was 45, and now the end is 24. So it's really a very big difference. And it's very important for her future.
For sure.
Yes.
For sure. Fantastic.
Yeah. So that was actually very short, but the story I wanted to tell in Melhorar.
Oh, yeah, it's fantastic. Fantastic.
Thank you.
Well, now, congratulations for all of this, okay?
Thank you, Patricia.
Now, another question is, does scoliosis of early onset kids have its own characteristics? And what points can be highlighted when dealing with early onset kids in scoliosis?
Now, those very small kids are very, very flexible. Everything is weak of those kids. The bones are weak, the discs are weak, the soft tissue, the muscles are weak. So those kids become very unstable. And when they create a scoliosis, then the complete spine and all the muscles and the brains, everything becomes to be unstable. And what we see of those kids is that they can't sit still on a stool. They always have to move. And the parents say, oh, please sit still. But they can't. They can maybe for a few seconds, but then the muscles are so weak, they are not strong anymore. The complete body is confused. So you can't expect from those kids to sit on a stool and still at school, for example, or on the table or where. And those kids are very tired. This is, of course they are tired when you can't sit upright because your muscles are not strong anymore and you are completely confused in your brains, then life is very difficult. Mm-hmm. So that is really with those kids, that's difficult. So we have to help those kids. And we have to strengthen their muscles and also bring again in their mind what is right and what is rotated and out of balance. Mm-hmm. So that's the difference that's the particular for the small kids.
Okay, fantastic. Thank you.
But that's the good thing of that is that we can do a lot of good things. When we can reshape the body of those kids, we bring it back. And what I do in my treatment is with the parents is repetitive movements of the thoracic. I have one example. I brought this with me. I have Sophie, for example. So Sophie has a thoracic curve. You can see? So
yes.
This is Sophie. Sophie hasn't a straight spine. Sophie has scoliosis. And then you see that it's not only sideward bending, it's also rotating. And when that is what you see, it is sideward bending, it is rotating backwards. So this is going backwards. And you see that the ribs are coming open and the ribs on this side is going close. Mm-hmm. So Sophie can't breathe anymore so much in this side. So we teach them to breathe at this side, and at that side we do repetitive movements. And I teach the parents to do that, to the medial, forwards, and upwards. So, and we tried in that way to interfere the disc between the vertebrae because they are getting wedge form. And when you do forwards, you say to Sophie, do a side bending, do a little bit like that. And then you do the repetitive movements, 40 times repetitive movements. And every parent teach to do that with the kids. We can interfere the disc of between the vertebra and the fluid of the disc in the vertebra. There is some fluid inside. And the vertebra, when you see that you have a spine who is, which side I did? This is Sophie. this side, then the vertebra is wedge form. It is smaller at this side, is bigger at that side. When we do the repetitive movement, then we can change the fluid in the disc, and then we can interfere and try to give the disc the normal form again. And I have seen when I do that with the children of my practice in from 6, 7, 8, 9, 10 years, and actually also the bigger ones, then I can find out that no one increased anymore. But I have to I have to instruct the parents very well. And of course, the parents are very unsure about themselves, and it is difficult to do. So you need regularly instruction of your therapist to do that. But those parents do that twice a day, 40 times. And then you see that there is no big increasing of the curve in my practice anymore with the young children. And the other thing what I do with the young children, but also with all the adolescents, is stretching of the nervus ischiaticus. That's the nerve of the legs. Because, and that was already from Professor Schroth in the last 100 years. He wrote about it, that when the spine is growing much more faster than the nerve inside, then you can find a torsion in the spine. So that's the reason I do with everybody who has a short nerve, we do stretching of those nerves. And also then we have good results.
Oh, good.
Am I clear?
Also, totally clear. Perfect. Thank you. And treating scoliosis requires a lot of dedication, study, and proper training, right?
Yes, for a very long time.
Yes, and I asking you why, and I asking you this because many people confuses structured scoliosis, which we can call true scoliosis, with a simple postural change that is easily solved. Quite different from scoliosis in the growth period, no?
Yes. The real scoliosis, the idiopathic scoliosis, is coming or from the nerve, the gross difference between spine and nerve, central nerve system, or it is coming out of the brains, and we don't know exactly how it started. There are more possibilities, but then you get always with a real scoliosis, a three-dimensional change. When there is a disbalance coming, and I can show with Sophie, then you have a three-dimensional. Yeah? The scoliosis, the spine is going to the lateral side, is also rotating to the same side, and is going forwards. It creates a flat back. And normally this, in the thoracic part, it is a little bit around. But with scoliosis, you create a flat back. So we have to change, to reshape this in three directions. We have to reshape the flat back forwards. We have to derotate, and we have to deflate again. That. Yes. And with a normal postural scoliosis, it is one-dimensional. It is, for example, because if you have a leg length difference. And when you change that difference, then there is no scoliosis anymore. It is not three-dimensional. When you are sitting then on a chair and you bend forward, you don't see a scoliosis. So that's much more easy to treat. But now you have to reshape the body in three directions. And that takes a lot of time and effort, because you have to reshape all the different things. You have to reshape the bones and sit straight forward. You have to interfere your ligaments, your discs, and also the soft tissue and connective tissue. So you have to reshape the body. And that's possible when you train a lot, wear a good brace, and, in my opinion, you continue very long. Until we do brace weaning starting when they are 17 or 18 years old. And then starting, because the soft tissue is strong when is stiff when you are about 23, 24. So when you start too early with weaning the brace and stopping with the treatment, and you have a very flexible ligaments and soft tissue, then the risk is that you fall again in your torsion, because you are still unstable, and you have to retrain your mind to find out. The brains has to teach. You have to teach your brains what's right and what not, to reshape. So that takes a very long time. So the treatment takes 4 or 5 years sometimes. But sometimes when you start very late, you can do it in 2 years, maybe 2.5. But I have never seen that it is a treatment of short period.
And it's okay so to say that I forgot the word, the curve of the learning curve in scoliosis is large.
Yes, it's large, yes. When they start with 10 to 13 years, yes, it is.
Mm-hmm. And for us, like professionals too, for us too, for the professionals who want to work with the scoliosis,
very long. Yes, yes, you have a very good connection with your patients, and they start with me in my practice individual. And when I teach them what they have to know, then, and also the manual things, then after that we do halfway. 1 week individual, the other week in a group. Mm-hmm. So I have a lot of groups, and I bring the kids together from the same age or things like that. The kids who have a good connection with each other. And they have WhatsApp groups and things. They say hello, goodbye to each other, and they have several talks. It is like a normal sport when they are visiting here. Some kids are coming every week in a group, and then we do a lot of treatment. But it is also a different treatment. It is a Schroth-based treatment with elements inside, with also balance elements. We do very coordination exercise with them. Different styles, we connect that. Mm-hmm. So and we are standing on unstable underground, and that belongs all to the treatment. Also power treatment, but also in 3-dimensional correction. We do the power. I use a lot of power in my treatment. It's not soft. Mm-hmm. And then we do it for several years.
It's important, oh yes.
Yes.
Mm-hmm.
Yeah.
Oh yes. For finally, can you say a few words to the people who are watching you here in Brazil about, of course, about scoliosis?
Yes. It's basically, I hope that the kids in Brazil can play a lot of time can play outside. So it's very important for their growth. And do sports, a lot of sports is very important for their growth. And the other is when they develop a scoliosis, go as fast as possible to a good educated scoliosis specialized physical therapist. And I hope those physical therapists, they develop a lot of skills to treat those children. And I hope that in Brazil is already, I don't know, but maybe in future there are good braces to help those children. But don't stop too early and bring all those kids together so that they have contact with each other. And then, in my opinion, they can stand for longer. They can continue till they are 17. And then they can decide when they start with weaning, because it's also there. It's a lot of effort they took in the treatment. So they don't want to destroy their own effort. So they need a good support of everybody, good physical therapist, a lot of help of their parents, and doctors, knowledge of the doctors, and also the kids can develop also the doctors, because in my clinic, a lot of patients of mine, they study now medicine, physical therapy, in nursery, and they bring it in their in their schools too. So that is, we have to build up like that. So in my opinion, we have to do, Patricia did a very good work in Brazil, and the patients have to help her. Patients, parents, we have to do it all together.
Yes. Oh, beautiful words. So nice to hear it.
Yes.
Dear Janine, my dear Janine, I sincerely thank you for your participation in our Escoliose Talks.
Well done. It's my pleasure to do it. And I hope that I can help with my results also next year in the Soulsworth. And when I can help you, I'm very pleased to do that, you know.
I'm sure that. Stay
Okay.
safe, stay well, my dear.
Thank you for you too all in Brazil. Bye-bye.
Bye.